What if the biggest challenges facing your healthcare organization this year wasn't due to external factors such as financial burdens or regulations, but it was really your beliefs and your mindset about those external factors? And what if your beliefs and mindset were the things that were holding your practice from completely transforming in 2025? Well, we're going to be discussing these issues and so much more in this episode of All Things Locs. All right, so today we're going to be discussing some hot button topics for healthcare in 2025, some of the challenges that most organizations, if not all of you, are going to face at some point this year. And I just want to really dive right into it. One of the biggest factors affecting any business, not just healthcare, is financial, right? We know it's a big issue. You need to make money, you need revenue, but what goes into all of that? And really what I want to start hitting on first and foremost is just some of the financial burdens that a lot of us in business are actually facing. And it's not just necessarily issues that have been stemming from COVID and some of the inflation challenges, which we're definitely going to hit on because that is part of it. But ultimately, over the last 4 or 5 years, give or take, if you don't know what the numbers look like from a standpoint of how much more employees are being paid and how much of that is driven due to inflation, I'll put it to you this way. Inflation has gone up about 21% over the last 4 years, and salary has risen about 25.7%. So if you think about that, somebody who was making maybe $100,000, 4 years ago, they're going to be making about $125,000 now. And if you multiply that by how many employees you have, think about if you're not making money that matches that, what kind of struggle is that creating? And then on top of it, you throw in the fact that inflation has gone up that 21% over the last 4 or 5 years as well, which makes things more expensive, right? So you have a scenario where you're paying suppliers more for goods and supplies, and you're paying employees more. But what if your revenue is not actually matching that? And what if your revenue isn't exceeding that? So that's really the first and foremost challenge that we're going to touch on. And the challenge that we then have too is now you have less providers and you have less people working in healthcare and the staff shortages that we're seeing. So understand this, that some of you out there might say, well, if I have less employees, then that should offset some of the costs, right? Instead of paying 20 employees, I'm now paying 10, so I'm saving. But you have to understand two things. Number one is supply and demand, which is you have less of something, that means the demand goes up, you have to pay a lot more for it. And then in healthcare, just like any other customer service kind of business, when you have less employees, the quality of care goes down. Now, if you don't believe me, how many of you have gone to a restaurant and the service, let's call it what it is, kind of sucks or it's really slow? And how many times has a server or somebody said, I'm really sorry, we're so short-staffed? And healthcare is the same, right? I mean, I've been to Chipotle, I love their product. Their service, a lot of times, it kind of is what it is. It sucks because you're waiting for something that used to take 5 minutes. You're now waiting like 15, 20 minutes. I know I'm not the only one. So this is what we're also seeing in healthcare where you hear the complaints of patients where they're saying, I have to wait 4, 6, 8 weeks to make an appointment with a provider. And I know if you are that provider, that's not ideal for you. Nobody in healthcare says, I want to make patients wait 6 or 8 or 10 weeks to come in and make an appointment. But this is what happens. So we see these challenges with less staff, more money being spent, and then it gets compounded when you look at, all right, how many patients are we now having to treat? All right, so there is, and we've talked, society has known about this for a long time, the amount of people who are baby boomers. And that generation is only getting bigger. And obviously as they get older, you get more health issues. And you need to see more doctors. But now you have less providers. So what do you do there, right? It's a little bit of a conundrum. And then you add on top of that, again, this is really a very enthralling topic. It's not positive, but we're going to get to that point. But then you throw on top of it financial regulations and what you're seeing from some agencies like Medicare and how they want to propose values-based fees, which if you're a provider, I know you love that topic. But you're seeing decreased reimbursements from Medicare, which has gone down, I believe, 29% over the last 24 years. And when you factor in, again, inflation, the decrease in reimbursements is even less. And when you look at how many laws and regulations are making it just more difficult to actually service patients, this is where we're at. Now, we're going to take this one level further, which is how does that play a role with reimbursement, right? Because I talked a little bit about revenue at the beginning of our conversation. If you're getting decreased reimbursements, and for those of you that are accepting insurance still, and that's a lot of you, you're reliant upon somebody else to pay you for your service, right? And it's somebody who's not very objective. They just making their own decisions. You know, we talked a while back about how many denials insurances put out. We know United Healthcare is the biggest one, about like 36%, but it's not like the other major insurance companies like Blue Cross and Aetna. They're denying about 15 to 20% of claims. So you're getting more denials, and then you're just getting overall reduced reimbursements for your care. So I want you to think about this. If I have less money, here's money coming in, that's going down, but then my costs are going up. So, yeah, I want you to understand as a business concept, like how the hell are we going to sustain ourselves long term if we have the seesaw kind of going in the opposite direction? So these are going to be some of the things that we're going to talk about today. And this is very important for us to understand. Healthcare is a field about giving and getting people better. But how do you combat these challenges? So what can we do? Right now, I explained how certain metrics, inflation's gone up, 21%. Medicare is reimbursed even less. And I wanted to add this one in because I completely forgot. We talked about some of the regulatory issues. Think about lobbying and how much industries spend going to Congress, giving them money to try to get some favors, right? And I'm pointing this out because I really just want to hammer home the challenges that we're facing in healthcare, that health insurance companies last year in 2023 spent about $157 million on lobbying, which was the third highest in the United States. And if you don't know what number one is, pharmaceutical. So there you go. And then within the top 10, you have HMOs as well. So the deck is stacked against you. Now, again, you could look at that and say, holy hell, the sky is falling. What can we really do? And I know, talking to some medical providers, and if you go on LinkedIn or you go on Twitter, which I know some of you probably like Twitter, but there is some good content out there, and it's good to get opinions. One of the things that I see some people floating out is, should doctors specifically unionize? And just trying to figure out what the hell can we actually do here. Especially, again, you see those numbers of how much the the insurance companies are spending on lobbying. Kind of makes you feel like there's just nothing you can do. Now, I'm a big believer in really two things. One is see things the way they are, and if you're in leadership, then see them for how they can be better and make it happen. But the other aspect that I like to really focus on as well, and that is very helpful for people who are running healthcare organizations, is we've all heard this before, control, focus on what you can control. And I don't have control over what health insurance companies are spending on lobbying. I don't have control over the government. I don't have control over Medicare. So if I then focus on what is within my capabilities to actually change, that's what I'm going to do. And that is honestly where I would say a lot of you need to start. And there's a reason that we opened this episode by talking about beliefs and mindset. All of us know a lot of insurance companies suck, that their major priority is to make profits, that they're a company too. So how do they make profits? Well, by increasing what we and the general public have to spend on insurance, but then also by denying claims and reducing how much they pay you. That is not going to change. Let's just call it what it is, at least not in the near term. So we could either complain about it, which a lot of us like to do. That is kind of becoming like our national pastime, which is complaining about stuff that we can't change. Or we can say, let's focus on what we can do within our group, our organization, our practice that will help us overcome these obstacles. And I'm telling you right now, if you're in leadership, and we're going to touch on that in a little bit, your goal is to look at these problems or challenges and view them as opportunities. And that's what high-level leaders do. They don't focus on the problems because it's very easy to do that. You can look at problems every single day and bitch and moan about it, but it's not going to change what is actually happening. So therefore, the people who are really trying to create some change are going to say, how can I make this problem an opportunity? And at bare minimum, they're going to say, how do I take this problem and create solutions? And this is what we're going to be talking about, is what are the solutions that we can put in place that are actually going to help us right now? Because creating action plans that take 5-10 years, a lot of you are not going to be around in 5-10 years because your practice is either going to be gone, or if you're old enough, you're going to be retired or have sold it all. So we have to focus on things that we can do literally right now. And what we're going to really focus on first is going to be looking at simple business concepts such as, what are you actually spending every single year? And Antonio, who's not here today, loves to talk about offense versus defense. And offense in a company is about how to increase revenue just through more sales, or if you're in healthcare, more patients, more services, more treatments. Defense is, where can I look to see what I'm spending that maybe I don't need to actually spend? All right, like you don't need that CRM that costs you $400 a month when you're using 1/10 of its capabilities. Or there was a good example would be a company that I was working with. Their credit card machine, it was a Clover. Now that's a great product that they were using, again, like 1/10 of its capabilities. So was it worth really spending the money on that per month? The answer is no. So they got rid of it and just went to a very basic credit card machine. And that's what I'm talking about. As you make money, it's very alluring to then want to spend it, because that's what a lot of us think we should do. It's like, I have the money now and we don't know exactly what to do with it. They don't know how to either reinvest it in regards to staff or equipment or investing into another company or product. So let me just spend it because I have it. And then before you know it, again, you're spending money where you don't need to. So the first thing I would say is learn how to play some defense. And I love this. Cost containment. How do I just keep my costs down? Because again, without making any more money, if you could just cut what you're spending. And again, I want to reiterate, this is not about cutting employees, like going into a clinic and saying, well, you don't need to work 40 hours. I'm going to pay you 30 hours and pay you as a part-time employer. It's not a matter of doing bullshit like that, because I do see some people doing that. Especially on those employees who are not the providers who are making the company revenue. Keep the employees the same. They're the ones that are they're the bread and butter of your practice. I'm talking about those needless spending. So I would start there first. And then when we're looking at it, I want you to then focus on, how do I take what I am spending and make it more maximized and more optimized? So then we're talking about operational efficiency. Now, if you've listened to any of the previous episodes, which if you haven't, what the hell are you waiting for? We've talked about how to be more efficient with your operations. And what that means is, what am I doing every day in my clinic or my organization that we do a lot of that I can maybe automate? So a good example of this would be, if you have like maybe 100 patients coming in per day, and then you're doing confirmation calls. I know some of you don't even do that, which we'll get into that in a second, but you're doing confirmation calls to call each patient to make sure they're coming in the next day. Now, I know some of you are probably also sitting there saying, who the hell still does that anymore? Some practices do. But would it make sense to have an actual person do that and sit there for however long that takes to make 100 calls? Definitely not, no. Now, you might say, well, it's a very personalized touch and the patients enjoy it. But again, do you need to be paying somebody in the office to do it? If you want to do that, great. Like, that is a very nice concierge kind of service. Does somebody in the office need to do that? Or is that something you can maybe offload to a VA in the US, offshore it, out of the United States, something that's going to just be more cost effective. And it also creates an opportunity then for the employees that you do have in office to utilize their skills and talents at a higher level. I mean, honestly, like how hard is it to call a patient and confirm an appointment? So that's one example. Or how can you automate your scheduling? Do you have chatbots that can help you with these kind of systems? And as much as I know that a lot of us in medicine are not big fans of EHR, and that actually I know reduces your efficiency, but it's like, how can you leverage software or technology to help you? And I don't want you just to think about this from a standpoint of your providers and the employees that are in the day-to-day with treating patients. I want you to also think about just every single department. Marketing, if you have a sales team or maybe a call center, what could you do there that would improve their productivity? And again, productivity doesn't mean I have them work more. The goal of productivity is to actually reduce how long it takes somebody to do something, or reduce the amount of steps, or it frees up their time to work on some higher level activities. So if you had maybe a call center who takes all the new patient calls and you freed them up then to actually have time to maybe call patients who you had discharged months ago to check in with them to see how they're doing. What could that do for your practice? Like, what's the perception that that patient has? If they're getting a call in 6 months from a doctor that had discharged them because they were doing well, to see, hey, how are you doing? Right? Think about the opportunities you might have. A, you improve your brand, your reputation, and B, maybe that person says, hey, look, I'm actually struggling, or I need to come back in, or I've been thinking about coming back in. So that's what I'm talking about when we look at operational efficiency, is take the things that you're doing a lot of or repetitive nature and start to figure out how to automate and create some systems. And then the third most important thing, which I had already touched on, is leadership. It's not just a matter of looking at problems and bemoaning and saying, what can we do? United Healthcare is horrible, or my reimbursement. We know that. Again, what are you doing to get ahead of the curve? Right? Like, we know this for years and years and years that reimbursements are getting less and denials are going up. So what the hell are you going to do differently to get ahead of it? Right? If you see something that's a pattern and it happens over and over and over again, why would you expect it to change? And that is very relevant for life and not just business, but we expect something different to happen when we do the same thing. And it literally makes no sense. If you want to say, oh, isn't that the definition of insanity? Like doing the same shit and expecting a different result? Pretty much, yes. But how many of you do that every single day? Instead of saying, all right, what can I do differently to get ahead of this? Now, because we didn't even talk about bringing in like a revenue cycle management company. Maybe it's a billing issue you're having. You know, we talked about operations and how to make it more efficient. Maybe that's something you do. You know, and that's where leadership steps in and says, all right, what can we do to get ahead of it? If I know that I'm getting more denials and I have insurance department within my company, am I actually tracking how often we get those denials overturned? Am I actually paying attention to, do we have the time to actually fight these denials? And if I don't, or if my denial overturn rate is not that great, can I hire an RCM company to help me with that? And if I'm paying maybe my billing department internally, how much am I spending on, their salaries that I can maybe get an RCM company to come in and help and supply some support? Because again, it's not a matter of, hey, let's get rid of the billing team. No, it's how do we utilize them appropriately? Because I know the complaint that I've gotten is, look, I'll fight the denials, but then I'm on the phone for 45 freaking minutes. That's a terrible use of their time. And then maybe you're the kind of employer who then goes to your team and says, why does your productivity suck? It's because I'm on the phone for 45 minutes trying to get a denial overturned for one patient, and I have a stack of them. So what am I supposed to do here? So leadership, again, I said this a few minutes back, leadership sees things for the way they are, not any worse, and they're not rosy. They're not looking at the sky falling, saying everything's great. They see for what it is, and then they figure out a way to make it look better, and then they start to make it happen. So this is the concept I want you guys to understand from a leadership standpoint of figuring out solutions and looking for opportunities and trying to understand how to get ahead of these patterns and how to be more proactive as opposed to reactive. So we talked about resilient teams, and I would advocate for you to actually check that episode out. Because when we're talking about healthcare, we know it's a field that is ever changing and evolving. So if you're the kind of person that wants to have things go the same way every single day, unfortunately, you might have got into the wrong profession, because this is an industry that requires you to kind of go with it. You got to like water. You got to flow with it. So you need to also have team members and a culture that is built around being adaptable, being resilient, not crumbling when you're presenting them the news of, hey, we got docked another X amount of percentage on our reimbursement, or we got more denials, or this healthcare insurance that used to pay us pretty well, now we can't even take because it reimburses so low. So you need to build team members that can kind of roll with the punches and also figure out, all right, how do we just keep making progress and moving forward? So those are our major talking points for today. I really hope you guys got something actionable out of this. The major thing I want you to take away from today's talk is to just focus on what's the one thing that I can do right now, right? Because we talked about getting your operations better, your leadership, your team members, looking where you can spend less. And you might look at it and say, well, that's just a lot for me to work on at one point. So I want you to be able to sit down and see what's the one area that we would be able to benefit from the most. And understanding too that some of these things might take some time. So maybe the question is, what's the one thing that would help us the most? Maybe the question is, what's the one thing that would help us the most right now? And what I mean by that is developing leadership. It's not a 1 week or 1 month training. It's months. I mean, my own journey took years, and really you might say leadership is just a forever journey. But to develop high-level leadership and the thinking process that comes with being more proactive versus reactive, that takes time. Whereas, all right, can I maybe look at some of our systems and maybe be able to put something in place within a week? So that's where I would say I want you guys to start. Obviously, the name of the game in any business, healthcare or not, is constant and never-ending improvement. How can we always make things better? So that's what I'm going to leave you guys off with. Hope you enjoyed this episode. Like, share, subscribe, and I'll catch you on the next one.